How do I see myself in the journey of discovery in environmental health? I think what I uniquely brought to the field was this laser focus to design studies that ask not only how do I measure chemical environmental factors, but how do I also measure social environmental factors, and how does that play out in the context of disease that we're looking at. It was my dream to go to medical school and be a physician, and I never would have imagined that this is how I would be having an impact.
Rosalind Wright is internationally recognized for her work in the breakthrough field of exposomics. Ros has broad expertise in environmental exposure assessment, as well as genetics, epigenetics, and psychosocial stress measurement applied to environmental health studies. This research promises to change the course of human diseases through identifying the role of the environment on human health.
Ros has had a major impact on the landscape of research here at Mount Sinai, and in particular, her impact on child health research has really been felt.
Exposomics matters to health because it has been the missing piece to the puzzle of what has been driving the increase in chronic disease burden in this country. Why do we see diabetes occurring earlier in children where we had never seen that before? We have to think on the full scale of the environment, not just chemical, physical environmental factors like air pollutants and metals and other toxins, but also the social environmental factors and social determinants like living in a safe community rather than having high crime and violence exposure.
I think throughout her career, Ros has really had this perspective of whole life events. And she realized that it really began in childhood and even in utero that could potentially affect the long-term outcome of these patients. And I think that's been one of her strengths in her research.
What moms are experiencing and exposed to gets to the fetus already. We start to examine air pollution exposure in women living in urban metropolitan New York area and incidence of asthma in their kids, and we've linked that together. We measure the social factors that might be driving that, and women were experiencing high levels of stress at the same time. That translated to increased risk of asthma.
I think when we look back on Ros's time here at Mount Sinai, she will be recognized for the tremendous contribution she has made to research in the area of health disparities and the effects of environment on people.
When I got the phone call that said, hey, congratulations, you're going to be awarded the Jacobi Medallion, I was just astounded. What we've been able to do in 10 years is just, to me, remarkable. It reflects what we saw in Mount Sinai when we were coming here, of giving people freedom to do high-risk, high-reward team science and really ask and answer the questions that we knew had to be done to address these 21st century health problems.